You know, mental health struggles are still running high here in Georgia and across the country. From daily anxiety to millions relying on medication, the need now for new solutions is also growing. Now, an Atlanta-based company is testing a different approach, connecting patients to community, not just prescriptions. Joining us now to talk about it is Chris Appleton, founder and chief executive officer of the healthcare platform Social RX. So glad to have you on this morning and such an important topic. So this all falls under what you could call social prescribing. So for viewers who haven't heard of that, what exactly is it?
Thanks, Jonathan, for having me. Social prescribing is when your doctor prescribes you participation in things like going to a dance class or a community gardening workshop. Here in Atlanta, going to the Botanical Gardens or the Alliance Theater to support your health, whether that be your mental health, to reduce stress, or even to improve your physical health.
Yeah, so important here other than just taking medicine. So what problem are you trying to solve with our current healthcare system with what you have now?
Well, we all know, as you spoke to, the growing mental health crisis here across the country, and Georgia is not unique in that. And there just aren't enough providers. We can't train and hire our way out of the problem. We have to get new solutions into the ecosystem and meet people where they are. And social prescribing is a well-worn practice that's been happening in the United Kingdom for 40 years, supported by the NHS, the National Health System there. And we are connecting patients to these community-based supports through prescriptions from their healthcare providers.
Yeah, so explain a little bit more about how Social RX works.
That's great. So we partner with health systems here in Atlanta, like Grady and Wellstar Health System. And a patient, let's say the Grady Cancer Center has a recent cancer diagnosis, which certainly many types of care are needed to support that patient. But with a recent diagnosis, as somebody is going through cancer treatment, they may struggle with their mental health. And their healthcare provider can prescribe participation in these community-based activities. And we connect those patients to community partners for them to participate in these programs.
So is the goal here to combine this with therapy or medication, or to have it separate, or work alongside it?
It works alongside. It depends really on the acuity level of the patient and what the patient's needs are, right? So some folks with mild mental health concerns that are maybe subclinical don't yet need to be in the care of a therapist or receive prescription for medication. This can be a standalone treatment or intervention, but certainly for individuals that need to be in the care of a therapist or other clinical provider, or need to be on medication, that this is an adjunct or addition to.
Yeah, it's still to most people a relatively new concept. So to people who hear this and think, okay, this sounds really nice, but if you're having some of these struggles, does it really work? What do you say to those people?
There's an abundance of evidence that shows that participation in community-based activities like art, nature, community supports, movement, and dance supports our health. There are centers for arts and health and arts and medicine across the globe, at Harvard, at Duke, at Johns Hopkins, at UCLA, University of Florida. In fact, today is International Social Prescribing Day, and so while this movement is relatively novel here in the United States, there's much evidence to support it.
Chris, before you go, got about 30 seconds here. Why do you think Georgia is the right place to kind of launch this model?
Georgia is a hub of innovation in both healthcare and in the arts. Atlanta is the cultural capital of the South. Many would say the cultural capital of the country. And we have incredible research institutions here in the Atlanta region, great health systems here in the Atlanta region, and a lot of need.
Chris Appleton, thank you so much for joining us this morning. We certainly would like to follow up with you on this as you get this program launched. Thanks for joining us.
Thank you for having me.
All right, and we'll be right back. Stay right here. We'll be right back.